7 hepatitis B symptoms you should never ignore. Hepatitis B is a serious viral infection that can cause severe complications if left untreated. This disease can be acute, lasting for a short period. On the other hand, it can also last a very long time and is referred to as chronic. Hepatitis B can often be asymptomatic, not showing any symptoms in some people, while it may cause mild to severe signs of liver damage in others. Due to the complications that may arise from this disease if left untreated, it's essential to be aware of the possible symptoms of hepatitis B to seek immediate medical attention once you notice any of them. In this video, we have put together 7 signs that say there's a high chance you might have contracted this disease. So without further ado, let's dive in. 1. Jaundice. This is a liver disease caused by the buildup of bilirubin, a waste product of the red blood cells. Jaundice is shown mainly by the yellowing of the skin and the whites of the eyes, indicating that the liver is not functioning correctly. The buildup of bilirubin is due to the liver's inability to filter it out of the bloodstream, causing it to be expressed in the eyes. Other signs of jaundice include dark urine, light-colored stools, and itching. 2. Abdominal pain. This is a common symptom of hepatitis B, primarily if it occurs in the upper quadrant where the liver is located. The pain can range from mild to severe, leading to other conditions such as nausea, vomiting, or loss of appetite. Also, this pain can indicate scarring of the liver or inflammation of the same. 3. Fever. Fever refers to a rise in body temperature above the normal range, usually caused by an infection or inflammation. Fever rage usually results from the body trying to fight off infections or foreign bodies. This is the case with hepatitis B, as the body tries to fight off viral infection, leading to a rise in body temperature. Furthermore, the temperature rise can also indicate complications from chronic hepatitis B infection, such as liver failure or liver cancer. 4. Fatigue. Fatigue refers to extreme tiredness or exhaustion that does not go away with rest or sleep. This exhaustion can signify acute and chronic hepatitis B infection, as the virus affects the liver's metabolism and energy production. Another cause of fatigue is anemia, a shortage of red blood cells in the blood that hampers the transportation of oxygen to the body's tissues. 5. Joint pain. This is discomfort or inflammation in one or more of the joints in the body, such as the knees, elbows, or wrists. This feeling can also be a symptom of acute hepatitis B due to the triggering of an immune response that attacks the joints. Joint pain can also be a sign of a chronic hepatitis B infection, such as vasculitis, an inflammation of the blood vessels. 6. Confusion. This state of mental disorientation or impaired awareness usually affects memory, judgment, or reasoning. This can be a sign of an advanced hepatitis B infection that causes the liver to malfunction and be unable to remove toxins from the blood. The accumulation of these toxins in the brain can lead to hepatic encephalopathy, which affects the nervous system and cognitive function. 7. Bleeding. Bleeding refers to abnormal blood loss from any body part, including the nose, gums, or skin. This can result from an advanced hepatitis B infection where the liver has been severely damaged and cannot produce the clotting factors responsible for stopping the bleeding. Another cause of bleeding is portal hypertension, in which the pressure in the vein carrying blood from the digestive organs to the liver, portal vein, becomes too high due to liver scarring, cirrhosis. In conclusion, it would be unwise to ignore these signs, which may indicate severe liver damage or complications. See your doctor immediately for diagnosis and treatment once you discover these symptoms. Hepatitis B can be prevented by avoiding exposure to infected body fluids or blood. You should stick to your doctor's advice on managing hepatitis B if you are discovered to have this condition, as this will help you manage your condition and prevent further damage to the liver. following are references we used to create this video. I hope you liked the video. Please do not forget to like, subscribe, and hit the notification bell. Thank you.